A kindred spirit is embarking on the journey of birth. Parents will look to you for guidance to create a birth that flows with the natural pulse of the universal life force. Are you prepared to help them bring their children into the world with love, honor, and respect?
Hi, I'm Dr. Carol Phillips, and I'm a chiropractor.
And I'm Angel Phillips, and I'm a craniosacral therapist.
And we're both doulas.
Meaning we're women who help women during birth.
We have created this video to help you educate your pregnant patients about the need for chiropractic care, craniosacral therapy, and doula support. Together, we can take your patients on a journey that explains the incredible design of the female body. We'll show them how subluxations and abnormal balance within the tissues of the body can set them up for complications during pregnancy. We'll take them through the mysterious and incredible journey of birth from an anatomical, biochemical, and spiritual point of view. Utilizing 3D animation, we will help your patients understand how a mother and baby are forming a symbiotic relationship as they dance their way together through the journey of birth, provided we do our part in restoring balance and harmony to her body.
There's no greater gift to give the universe than to help a family bring a child into the world with love, honor, and respect.
Help us spread that message to the patients and clients who come to us for help and guidance.
Pregnancy should be one of life's most precious and beautiful experiences. It should be a time that's free of physical pain and full of unbounded emotional joy. Chiropractic prenatal care that incorporates craniosacral therapy can help a woman remain vibrant and energetic throughout her pregnancy. By removing any interference to this natural state of health, a mother and her unborn child will unite in an oceanic blend of energy and identity. Unhindered, they will function as a perfectly balanced team as they dance their way through the journey of birth.
Wow, a trampoline! I think I'll stay and jump a while.
We'd like to share with you our perspective of life within the womb and the importance of maintaining and restoring balance within the mother's musculoskeletal system.
As a baby lies nestled in his twilight world of water, sound, and movement, he trusts that his home will always remain open, expansive, and accommodating to every playful move.
However, if a baby's environment becomes too restrictive due to distortions within the mother's body, he's going to be confined to whatever space is available to him.
Sometimes the restrictions become so severe that the baby can no longer move freely. Eventually, this restrictive position will cause the baby to press against his mother's body, which may cause her pain for days, weeks, or even months.
If the confinement is very severe, we find mothers coming in for chiropractic care and craniosacral therapy with a wide range of symptoms that range from pain caused by musculoskeletal imbalance to mysterious emotional anxiety. Sometimes after a thorough evaluation, we find that the problem is within the mother and she has a structural imbalance. At other times, we find her symptoms are just a warning that the baby is imbalanced and he's probably very uncomfortable.
In that case, if the baby is uncomfortable, instead of rolling and tumbling in utero, the baby will punch and kick and try in any way possible to let the mother know that he's stuck.
You know, chiropractic adjustments and craniosacral therapy are both very effective tools for restoring balance within the mother's body. This will reduce her pain and give the baby much more room to move freely.
Hey Mom, will you please eat something? I'm kinda hungry.
A new mother must provide her unborn child with a home that serves as an ever-expanding playground, full-service cafeteria, and warm, comfortable cradle all in one package. To achieve this, an incredible balancing act takes place within a mother's body during every moment of her pregnancy.
muscles, ligaments, joints. Any imbalance in these structures can move a woman away from a state of physical stability and into a state of dysfunction, discomfort, and possibly even dis-ease. To fully appreciate a mother's remarkable ability to form a symbiotic relationship with her baby, let's take a look at the design of the female body. Deep within the abdominal cavity lies the uterus, home for the baby. A group of very important ligaments anchor the uterus to the bony pelvis. The two largest ligaments are the broad ligaments in the back and the round ligaments in the front. While these ligaments provide little gravitational support, they do allow for dynamic motion of the uterus. In order for a baby to move freely and a mother to stay pain-free, it's important that these ligaments remain in a state of balance from side to side and front to back. Imagine for a moment that the pear-shaped uterus is a hot air balloon. The balloon is tethered to the ground to ensure that it will not float away. If someone does not anchor the balloon properly, it will tip over. Likewise, if the uterine ligaments are not balanced from side to side or front to back, the uterus will also tip over, either to the front, back, or side of the mother's abdomen. The mother may be aware that she has a tipped uterus, but she may not recognize the uncomfortable effect this position will have on the growing baby within her uterus. If there is an increase in the tension of the round ligaments which attach the uterus to the pelvis in the front, the mother may experience pain in her thigh, abdominal cramping, cervical pressure, or premature contractions. On the other hand, if there is an increase in the tension of the broad ligaments that attach the uterus to the sacrum, the mother may begin to experience extreme back pain during the pregnancy. And finally, if a ligament on one side of the body contracts more than the other side, the uterus will be pulled sideways. This off-centers the baby and causes the mother rib or hip pain. If this happens, the baby will have to flex and rotate his head to get through the birth canal. Later, he may develop torticollis and a flattened skull as a result of this sustained position in utero. Stabilizing and supporting the uterus are muscles that fit like a series of hammocks within the pelvic bowl. The deepest layer runs obliquely from the sacrum to the ilium. The middle layer is anchored from side to side, and the top layer is anchored from the front to the back of the pelvis. These muscles support the uterus against gravity, mold the baby's cranial plates during the last trimester, and guide the baby smoothly through the birth canal. There are muscles outside of the pelvic bowl that stabilize and support the bony pelvis for normal joint function. One of the more important muscles is the piriformis, which connects the sacrum to the femur. A piriformis spasm on one side may result in severe sciatic pain on the opposite side. On the other hand, a spasm in both muscles may result in low back pain. During birth, a spasm in one or both muscles will also reduce the flexibility of the sacral segments and hinder the baby's descent down the birth canal. Everyday life will affect the delicate balance of ligament, muscle, and bony alignment. If a pregnant mom carries a young child on one hip for long periods of time, she must contract her muscles to arch the supporting hip upwards, causing one form of imbalance.
Taking a child in and out of a car seat can form another form of imbalance.
And so will sitting at a computer with the monitor off-centered.
And if they don't use pillows to support their back and elevate their legs while sleeping, twisted postural muscles may also imbalance the body of a pregnant mother.
And it doesn't stop there. Any previous injuries from accidents, sports, occupational stress, or even their own birth can cause an imbalance within the mother's body. As you can see, it's pretty easy to get out of balance. Angel and I have treated thousands of women who've complained of leg pain, back pain, heartburn, and premature contractions. In most cases, after just a few chiropractic adjustments
And craniosacral sessions,
their symptoms have either greatly reduced or completely resolved.
however, there are no guarantees.
Even with the best of medical prenatal care, chiropractic prenatal care, and craniosacral therapy, a baby can still get himself all wound up in the cord, and problems at birth may still happen.
But there's no reason for a mother to go through pregnancy with pain and discomfort. Most of the time, this is easily corrected.
Hey, Dad, will you read me another story? Mom keeps falling asleep.
A baby will prepare for birth long before active labor contractions begin. During the last 4 weeks of gestation, provided her life is not consumed with other activities, a mother will spend many quiet hours connecting with her baby. Silently, they will get to know each other as they physically prepare for the journey of birth. During the final stages of pregnancy, a mother will help her baby line up his body so that her muscles can slowly twist and turn to maneuver him through her pelvis in a safe and natural manner.
When preparing for a birth, a mother must remember that the miraculous design of her body will help her baby slowly, gently, and with great precision mold his head to accommodate her unique shape. She must also realize that she will feel a need to move her body in subtle ways to accommodate her baby's position within the birth canal, and that she must tune into those needs.
This constant give and take, with each responding to the other's movement, is the dance of life, the miraculous journey of birth, and a true marvel of nature.
Mom, I'm getting tired of being squished in here. I'm hugging myself as tight as I can, but it's getting harder and harder to move my hands and feet.
Around the 7th month of pregnancy, the volume of amniotic fluid in the womb starts to drop. This change in fluid dynamics gives the baby more room to grow while decreasing his buoyancy. Gravity can now take over and pull the heaviest part of his body, his head, down against the lower cervical portion of the uterus. The uterus, the baby's spine, and the mother's spine will now all become parallel with each other. This is essential for an uncomplicated birth to occur. Ideally, after much tossing, turning, rolling, and playing, the baby will position himself with his back on the mother's left side. Most babies will assume this position because the mother's softer organs, the stomach, spleen, and pancreas, will move up against the respiratory diaphragm and make room for him to stretch out. There isn't as much room for a growing baby's spine to reside on the right side of the mother's abdomen because of the harder, less flexible liver that rests on that side. If the mother's sacrum is rotated, causing a subluxation at the site of the sacroiliac joint and a torsion of the pelvic bowl, an imbalance in the uterine ligaments will constrict the lower portion of the uterus, forcing the baby out of this optimum position. Gravity can no longer influence the baby as the tight, constricted fibers of the uterus force him to turn into an oblique, transverse, or complete breech position. Correcting the subluxation and restoring balance to the muscles and ligaments within the mother's pelvis, often called the Webster technique, will quickly and effectively restore the pelvis to normal, and the baby will drop back down into the optimum position within the uterus. During the 3rd trimester, very gentle contractions that hug the baby also begin to push him downward against the cervix. These Braxton Hicks contractions should be mild and barely perceived by the mother. Ideally, the baby's arms and legs are now flexed against his chest. At this point, with the long axis of the baby's spine perfectly perpendicular to the long axis of his head, Braxton Hicks contractions will force the baby's spine downward, forcing it to apply symmetrical pressure to the condyles of the occiput. If the baby is positioned correctly, the contractions will slowly and gently force his sphenobasilar joint and head into a flexed position. As the baby's chin is forced against his chest, the vertebra will stack up and protect his spinal cord and nerve roots from the forces of labor. With his head tucked tightly against his chest, the baby will now have the crown of his head resting against the top of the mother's cervix, with the widest diameter of his head parallel with the widest diameter of the mother's pelvic inlet. In order for an unborn baby to effectively fit through the mother's cervix and pelvis, his cranial plates must slowly overlap each other, and the volume of cranial fluid must be reduced. This will be achieved through a unique process called cranial molding. As the exposed, unossified dura mater folds inward, allowing the plates to overlap and reduce the circumference of the cranium, a protective encasement is formed for the many blood vessels that supply blood to the brain. The molding process begins when one parietal bone at the top of the baby's head comes to rest against a lip of a bone in the top of the mother's sacrum called the sacral promontory. Ideally, this will be the baby's left parietal bone. The first layer of muscles, which are directed from the front of the mother's pelvis to the back, will apply pressure to the right side of the baby's head. This forces the right parietal bone to slide slightly under or over the left parietal bone. The reduced cranial circumference now allows the baby to slide further down, which forces his head to apply pressure against another layer of muscles that stretch from side to side within the mother's pelvis. These hammock-like muscles of the urogenital diaphragm will assist the baby in telescoping the cranial plates at the front and back of his head, under or over the parietal bones. Prolonged contact of the baby's head against the cervix will stimulate a cascade of hormonal responses in both the mother and the baby. The release of one hormone, oxytocin, results in stronger and more rhythmical contractions. When delivery is imminent, the mother's cervix softens and thins out in order to blend in with the wider part of the uterus. The shortening and thinning of the cervix allows the baby's head to rest directly against the os, the opening into the birth canal. Continued pressure against the os initiates the active stage of labor.
Whoa, Mom, do you feel that? We can do this, Mom. We can do it.
Birth is a dance of power, strength, and agility, provided both are in proper alignment and not forced to perform the dance of birth prematurely.
To help a mother deal with the intensity of labor and delivery, we often recommend the use of visualization and vocalization.
With intense contractions, we encourage a mother to use a vocal sound that will vibrate the lower portion of her abdomen and relax the pelvic floor muscles. We also ask the mother to visualize her cervix as a rosebud that is opening petal by petal with each contraction. At the same time, we ask her to visualize the baby's head getting smaller and smaller, like a rose whose petals are folding inward. Eventually, the baby's head looks like a rosebud that is sliding through the mother's open cervix, which now resembles a rose in full bloom.
What the mind sees, the body feels.
If the mother's body is in a state of balance and the baby is in the optimal position, effacement, thinning of the cervix, and dilation, opening of the cervix, will be symmetrical, and the baby's head will now pass through the pelvic inlet. Now that active labor has begun, the baby's head will rest upon the mother's oblique pelvic floor muscles, which apply pressure to the side of the baby's head, specifically the temporal plates. As the oblique muscles force the temporal plates to fold together, the baby's neck muscles rotate his head toward his left shoulder and activate the primitive asymmetric tonic neck reflex. This will result in an elevation of the left shoulder, which then reduces the diameter of the upper torso. Ideally, the baby will turn his face toward the curved portion of the mother's sacrum, and the back of his head will line up under her pubic bone. The baby can now slide even further into the birth canal. Once he moves past two bony points inside the mother's pelvis, called the ischial spines, he will continue to turn another 45 degrees until the widest diameter of his head lines up with the widest part of the pelvic outlet, the vaginal opening. As the baby rotates through the birth canal, the contractile forces of the vaginal wall stimulate one side of his spine, which activates the primitive Gallant reflex. This results in hip flexion and a decrease in the diameter of the lower portion of the baby's torso, allowing the baby's pelvis to slip through the fully dilated cervix. Crowning occurs when the top of the baby's head can be seen at the vaginal opening. As he slides through the opening, pressure from the anal gutter will force his head backward into extension. This will accomplish two things. 1, the back of his head can slip under the pubic bone, and 2, the primitive Perez reflex will be activated by strong contractile stimulations to the baby's entire spine. Extension of the baby's head will result in extension of the baby's pelvis and legs. That, along with the influence of the Perez reflex, will cause the baby to eliminate any remaining amniotic fluid from the lower urogenital tract. The result is a tight, compact pelvis passing through the birth canal. Extension of the legs and pressure of the uterine wall against the top of the feet will fire another primitive reflex that forces the baby to simulate walking, thus pushing against the top of the uterus. Once his head is out of the canal, the baby must roll his shoulders around so they too can line up with the widest diameter of the vaginal opening. To accomplish this, the mother's oblique pelvic floor muscles apply pressure to the shoulders, turning them until they can slip past the ischial spines. This results in the desired head rotation. As the baby's shoulders roll to line up with the vaginal opening, his neck muscles will slowly turn his head back toward his chest. Once the baby's shoulders are lined up properly, he will proceed to roll his body out of the birth canal. After delivery, the baby will intuitively cry out in vibrant bursts of sound to 1. Restore normal fluid dynamics by forcing cerebral spinal fluid and blood back into the cranium, 2. Force air into the lungs to initiate breathing, and 3. To initiate a proper rhythm within the craniosacral system.
The description of labor and delivery you have just watched describes an ideal birth. Without proper balance and alignment between mother and baby, a whole variety of potential problems may occur. If the labor is induced prior to the baby getting into position for birth, the labor may become stalled or arrested entirely. If the mother receives an epidural, she may not be able to tune into her baby's needs, and the level of endorphins normally provided to the baby may be reduced, resulting in an increase in pain for the baby. And unnecessary intervention and disruptions may reduce the mother's ability to work closely with her baby and her own body. These problems and suggested solutions will be discussed in future videos. Along with proper chiropractic care and craniosacral therapy, parents should consider adding a doula to their birth team. Research studies have clearly proven that the incorporation of a doula can reduce the need for medical intervention, shorten the duration of labor and delivery, decrease cesarean rates, and improve the emotional satisfaction of the birth experience for both parents.
As a mother and her unborn child dance into their new life together, I encourage her to relax and trust in the knowledge that the birth team she's put together is there at her side, ready to help. She can rely on her doula and birth team for emotional,
Physical,
and spiritual support.
no matter how much support a mother may get from her birth team, she'll eventually realize that this is her dance, her work, and ultimately her reward.
Good job, Susan.
That's it, just a little more.
Just relax your
Good,
legs.
easy. Just a little bit more, Sue, just like that. A little bit more.
Baby's head's
Easy.
coming out.
Half the head's out. Okay, a little more. Good, good.
There,
Okay, good.
there,
Easy does it. And just give me a little nudge there.
Just a little bit.
nudge. There you go. Okay, good. There you go, Sue. Just a little bit of a pusher now. Good. Cute looking mug, huh?
It is. I can
Hey,
see
now,
eyes
just a
and
little bit of a
ears.
pusher now, Sue.
Little push.
Good
There
job.
you go. Easy does it.
Just relax.
Nice, easy push. Lots of pressure there, Sue. Hey, easy does it. Just for a second there now. Sue, Sue, easy does it. No, everything's going fine. You're doing fine.
Real great.
Okay, now just ever so gently now, Sue.
Looks beautiful.
Easy, easy, easy. That's it, Sue.
That's
Good.
beautiful.
Good. Okay, easy does it now, Sue. That's it. Easy.
Good job.
Just take the baby step. Put your hands one on either side.
Okay.
Okay. Okay, good. There you go, Sue. Hang on, baby. Hang on.
I got it. I got it.
Okay, now, Sue, grab a hold there.
Yeah.
Grab a hold there. Under the shoulders there, Sue. Yes, you can. Easy. Okay, now help us. Hang on your baby there. Now bring right to your chest there, Sue. Here's our little baby. What do you got, Sue? It's your little daughter. Here, let's lay her right on her side here. Here, she says, hi, Mom. Good job, Tim.
A mother and her baby are a team. And if the mother is free from muscular imbalance and unnecessary obstetrical intervention,
They're both capable of doing whatever it takes to finish the dance they so lovingly choreographed together.
Hi, you guys. I love you too.